when walking becomes difficult, when every step starts to feel like a punishment, and when knee pain begins to take over every joy in life. A person starts to feel that perhaps there is no solution left. But today, I want to talk about a new hope. A modern treatment that can help you regain your mobility without a major surgery. Just think for a moment. Have the small joys of life, such as playing with your children, standing comfortably in prayer, or simply taking a peaceful walk in the garden, become nothing more than a distant wish? You see, knee pain is not just a physical problem. It creates a feeling of helplessness that slowly drains a person emotionally and mentally. And believe me, you are not alone in this journey. In Pakistan, a condition called osteoarthritis is increasing rapidly. In the past, this disease was usually seen in people over the age of 40 or 50. But today, due to changing lifestyles, obesity, low physical activity, and metabolic health problems, this disease is now being seen more frequently in younger individuals as well. If osteoarthritis is not treated in time, it can severely affect a person's quality of life. Unfortunately, many patients are immediately advised to undergo knee replacement surgery. However, it is a major operation. Recovery can take several months, and it is not necessary for every patient. The good news is that not every patient needs knee replacement surgery. Modern medical science now offers an advanced treatment called genicular artery embolization. This is a minimally invasive endovascular procedure. In this treatment, we reach the small blood vessels around the knee that are responsible for increasing inflammation and pain. When these abnormal blood vessels are blocked, inflammation decreases, pain significantly improves, and patients begin to regain their mobility. So how is this procedure performed? There is no large incision and no major surgery involved. Typically, a very small catheter is inserted through a tiny artery in the leg or groin. Using X-ray guidance, we carefully navigate to the specific arteries around the knee. And microscopic particles or medication are used to block the abnormal vessels. The entire procedure is safe, modern, and minimally painful. Most importantly, many patients are able to walk and go home within a few hours. Genicular artery embolization offers several important benefits: significant reduction in knee pain, improved mobility, better quality of daily life, and many patients can avoid expensive knee replacement surgery. This treatment is especially helpful for patients who have moderate to moderately severe osteoarthritis, have not improved with medications or physiotherapy, and whose daily life is being affected by knee pain. Dr. Imtiaz Ahmad has been successfully performing this advanced endovascular treatment in the United States, and this modern technology has now been introduced in Pakistan as well. If you or someone in your family has severe knee pain, difficulty walking, or has been advised to undergo knee replacement surgery, then before deciding on surgery, it is worth learning about this modern treatment option. You can send your medical reports, X-rays, or MRI scans through WhatsApp, and we can guide you on whether this treatment may be suitable for you. Dr. Imtiaz Ahmad, endovascular, surgical, and interventional radiology specialist, for appointment call 0-331-1110 397 0-33029 633-000-3312 597322.